also for? Okay. Okay. Good evening. Today, you can see I'm joined by CS Magoha and Governor Kuti. After I finish my statement, they will also come up to the podium and make some remarks as well. Today, we acknowledge positive steps we have made towards the management of COVID-19 patients. I am delighted to announce that today we have surpassed the 100 mark for recovery of patients. In the last 24 hours, we have discharged 8 patients from our hospitals. This brings to 106 the total number of our recoveries. We have noted the number of recoveries steadily going up while fatalities have stagnated. In the last 1 week, the number of those who have died from COVID-19 have remained at 14. Within the same period, we have discharged 39 persons. This is an indication of the dedication of our healthcare workers. From the bottom of our hearts, we want to thank our medical and health workers for the role they have played in this fight. They remain our frontline soldiers, without whom fighting this war would be extremely difficult, if not impossible. I therefore want to appreciate all those organizations that recognized the critical role of healthcare workers and have come up with initiatives to care for and appreciate them. In this regard, I want to acknowledge Absa Bank Kenya PLC and Minet Kenya Insurance, who are now providing psychological support care to our health care workers and those in quarantine facilities, isolation centers, and their families. I wish to remind those who may be experiencing any psychosocial distress to reach out to them on this number for counseling and support. The number is *202*04#. I repeat again, for counseling, support, you reach out to this number, *202*04#. Even as our health workers dedicate their time to manage our healthcare facilities, their efforts alone will not be enough in flattening the curve. It requires all of us to exercise our individual contributions by observing the various intervention measures we have continuously advocated and announced. I want to thank Kenyans for observing these measures. The achievements we have registered could not have been possible without everyone's cooperation. I want to thank our mamambogas, border operators, matatu operators, the youth, the taxi drivers, local entrepreneurs, and many others for their contribution to this fight. However, even as we celebrate these achievements, we cannot afford to become complacent and lower our guard. We must stay focused and maintain the course. And I want to appeal to those Kenyans who may not be strictly following the directives to please do so. It's extremely important that we follow these directives because it is the only way that we will be able to interrupt the transmission cycle of the virus and register some level of success in bringing down the numbers. While at this, I would also like to urge counties to strengthen the multi-sectoral structures so that various sectors play their respective roles in responding to this pandemic. And I'm sure that Governor Kuti will talk to that when he comes to the podium. Communities should regularly be sensitized on infection prevention and control measures for COVID-19, including the role of nutrition in boosting the body's immune system and speeding recovery from illness. Early this month, the Ministry of Health released 2 guidelines, key nutrition messages to contribute to prevention of COVID-19 and the interim guidance for nutrition management of COVID-19 for health workers in treatment and isolation centers. These guidelines give recommendations of the foods we should consume to remain healthy, and therefore I urge county governments to make use of the guidelines and to disseminate the information to the communities. Yesterday, we marked World Malaria Day. On a light note, we would like to remind all of you that mosquitoes are not under quarantine or lockdown. They are still spreading malaria, and the same for other carriers of pathogens. We need to protect ourselves from mosquitoes and to be on constant lookout for malaria symptoms such as fever, headache, joint pains, nausea and vomiting, which coincidentally are also symptoms for COVID-19 disease. If you experience these symptoms, you need to visit your nearest health facility. Malaria testing and treatment are still available and are offered free of charge in all government health facilities. County health departments in malaria transmission areas at the coast, lake region, and the Western Rift need to be vigilant and closely monitor malaria trends to ensure that there is no outbreak of malaria which may further strain our health services. Following the directives of His Excellency the President, the National Emergency Response Committee on Coronavirus has today met and will be releasing guidelines for partial reopening of eateries and restaurants. In the meantime, the National Emergency Response Committee has directed the following. 1. Testing of truck drivers to start immediately at all border crossing points. The county governments to increase training of their healthcare workers by utilizing the already trained personnel as trainers. 3. The Ministry of Health, in collaboration with the county governments, to identify COVID-19 isolation facilities at county level 4 and 6 facilities. In the last 24 hours, we have confirmed 12 new cases of coronavirus in the country, bringing the total number of confirmed to 355. 8 of these are from Nairobi and 4 from Mombasa. All the 12 are Kenyans, but 3 have a recent history of travel from Somalia. They are aged between 14 and 60 years. The Nairobi cases are spread between Kibera 2, Karen 1, Dandora 1, Isli 1, Kasarani 1, South B 1, and Umoja 1. Mombasa's cases were found in Mvita Kuze 1, Misho Moroni 1, Mvita Bondeni 1, and Barsheba 1. I thank you, and I now take the opportunity to invite CS Magoha to come and make his address.
Mine will be a very short one. The government loves all our children, both with special needs, those who come from poor vicinities, the middle class, and those who are able. I want to emphasize the fact that for the past 4 weeks or so, the children have been on normal vacation, an activity that will end on the 4th of May of this year. And in the interest of the safety and lives of our children, our beloved children, the government has decided to extend school closure for 1 month, effective from the date of opening. During the intervening period, there will be many interventions that will depend on how the government is able to control this disease. I want to emphasize one point, that whenever the examination is going to be administered, every child, every Kenyan child will have been given the opportunity to cover whatever time that is lost before the said examination is administered. At this point that I'm speaking to you, the government has not decided to postpone both the Kenya Certificate of Primary Education and the Kenya Certificate of Secondary Education. I hope I have preempted your questions with regards to exams. Let our children enjoy their last week on holiday and then start the 1 month that has been added to them. Thank you.
Thank you. I would like, on behalf of the county government, first to thank His Excellency, the President, for extending the measures of the curfew and also the movement in and out of the counties with high COVID prevalence. This is because we feel the results are yielding the measures are yielding good results, and therefore we fully support as county government. We also fully support the initiative to push manufacturing by local capabilities, to encourage our local capabilities to manufacture personal protective equipment, ventilators, face masks, and only we now urge that KEBS, that is Kenya Bureau of Standard, to also enhance their capability at the county level so that this manufacturing is not only centralized in Nairobi, but also in the counties, because a lot of efforts are happening at the county. First, a lot of young people, women groups are manufacturing face masks. It is important that those face masks are standardized and are verified so that they meet the required specifications. Talking about face masks, I would like to point out that face masks are put on to prevent entry of the virus into the nose and into the mouth. I am seeing like 60–70% of Kenyans putting face masks below the chin, and therefore walking like that. They have face masks, but they are not putting it in the right way. The face mask purpose is to prevent the entry of the virus or the exit of the virus if you are infected. Therefore, let us carry this message very strongly that we should wear the face masks appropriately so that it does the function it's meant for. I would like to also state that because of stigma of health facilities, pregnant mothers are fearing to go to health facilities. Immunization has now gone down, and today in our National Emergency Response Committee, efforts are being discussed, and there is going to be discussion between Council of Governors and Ministry of Health in order that we identify COVID health facilities away from normal health facilities so that the gains that we have made in immunization and in reducing maternal mortality because of the attendance to antenatal clinics, the malnutrition that we have countered because of regular weighing, and other activities like HIV and TB should not be lost because of mixing COVID patients and other normal patients, to the extent that people now are shy to going to seek health care. So this is, I think, a message I want to deliver. And in the meantime, I would like to encourage community health volunteers to encourage those services to continue at the community level, and also encourage those who need to go to deliver at health facilities or to be attended at health facilities to continue as normal. Finally, I would like to comment on what has appeared on yesterday's papers about classifying and graduating performance of governors. I think it is not in the spirit of the time to classify governors. This is a time for unity of purpose. This is a time for encouragement, and it is not time to call others villains. I don't think it is fitting the time. We have statistics from all counties as Council of Governors about the formation of county emergency response committees have been formed in all counties. Counties have put in place the various requirements by Ministry of Health. I will seek, and I will seek the indulgence of the Fourth Estate to desist from, at this particular time, engaging in classifying or political initiatives, because this is the time all Kenya is supposed to come together. And the Mwananchi has his role, county government have their roles, and national government have their roles. Let us all play our roles, and let us have unity of purpose, and let us not have a system that discourages any of these players, because we need each one of them at this particular time. Thank you very much.
Those standards in a single day.
Daktari, just one question for you. Kwa mujibu, jina langu ni Wawero Nyambura. Kwa mujibu wa sheria ya afya, Thank you, daktari. Kwa mujibu wa sheria ya afya, yule ambaye anapatikana na hatia ya kuvunja hii sheria anawekwa katika quarantine ya lazima. Lakini tumekuwa tukiona viongozi wakivunja hii sheria kwa kuleta wananchi pamoja. Hao watachukuliwa sheria ambayo wananchi wanachukuliwa, ama sheria inakata msumeno upande upi?
Okay, my name is Kenna, People Daily. I just want to know the effect that in terms of malaria, because the concern is that people are fearing to go for checkup because it has been commercialized. There has been an element of a commercial element that you might test positive for corona and you do not have the financial capability. I don't know if that has affected you in the country.
The inability to...
Once you go to the quarantine, you have to pay. Yeah, there's that effect.
Okay, let me begin with the first question, which is in addition to mass testing to include truckers crossing border points, which other areas have we recognized as being important for testing? We have already mapped out all the high-risk areas, and we've been able to map that out by looking at where most of this transmission, what we are now calling community transmission, is happening. Clearly, the counties that are under restricted movement are key areas that we need to do a little more testing. We've actually been doing that. If you remember, we have reported testings that we have done in the KPA and many other places. So we will be moving into these areas and doing more testing in those areas. We will also be targeting vulnerable groups. You know very well that people who are aged and who may have comorbidities are also at higher risk. So those are some of the groups that we will also be targeting in addition to the high-risk areas that we have already identified. There was a question regarding what I saw in the nation today on dismissal of at least the nation stated that there was a dismissal of a scientist in Cambridge. What I want to say is that we must keep our eyes on the ball and focus on what is important. And if there were problems in terms of coordination of collection and transmission of the test results in good time so that we can report to you and to the nation, then it is our role to ensure that we are able to do that and coordinate it properly. So whatever decisions were made were in line to streamline and improve the coordination of test results being received in good time. The other issues are administrative issues within KEMRI, and I would like to leave it at that. KBC asked how many samples did we test in the last 24 hours. We have routinely been testing in the last couple of weeks in the range of between 700 to almost 1,000 samples a day. In the last 24 hours, we tested just over 500 samples, which brings me to the next question here, which was, what is our testing capacity? You have stated that KEMRI, that you have information, we have a testing capacity of up to 30,000 per day. I can say that indeed we have the instruments to be able to test a large number of tests in a day. However, we are restricted at times because of the supply chain. As you're aware, globally, most of these reagents that are used in testing, and not only testing, but even the PPEs, the masks and ventilators and many other commodities that are used for this COVID response are in short supply globally. I think you are aware of that fact. But we have been working very hard with suppliers and manufacturers of these products to be able to ease this strain. And as Governor Kuti stated here, As far as PPEs and masks are concerned, we have invigorated our local industry and repurposed them to be able to produce these, and they are doing this and meeting the demand. But in terms of some of these other commodities, like the testing material, we have to work with the manufacturers, and they provide us with the quotas that they can provide us. It is these quotas of supplies that we are able to get that somewhat limits our testing capacity. But I think going forward, we should be able to test more and more numbers and go beyond the 1,000 and hopefully 2,000. We should be reaching the 2,000 tests a day very soon when we now roll out to full strength the targeted enhanced testing that we plan to do. Mwisho, kuna bwana pale aliuliza mambo ya quarantine, na niliongea siku ya Friday, siku ya Ijumaa, niliongea kwa Kiingereza juu ya yale mambo ambapo ilitokea sehemu za Meru na Elgeyo Marakwet. Na nafikiri enough has been said on that, even in the press. So I would like to say that the message probably has been delivered very well to the political class in terms of not encouraging mass gatherings of people, because this will then promote a spread. And I'm sure that they are heeding that very well. Thank you. Let me ask Governor Kuti to come to the podium.
Just to reinforce the issue of testing, it is very, very important that we have that capability in order for us to be able to understand the extent of the disease in the country. But I really concur, this is a challenge, but have just come out of this National Emergency Response Committee meeting. We now have about 5,000, and by, I think, this week, beginning Monday, we will be able to receive 24,000 more tests, so that we are able to increase our capability for testing. But that still remains a challenge because it's not enough. But it's not enough in the US, it's not enough everywhere, because these are commodities highly in demand all over the world, because this is a pandemic that is happening everywhere. The issue of quarantine, I would like to speak in two ways about it. Number one, the counties are very much anxious about the fact that people who are collected from curfew are being taken to quarantine, because people who drink or are walking on the street during curfew are lawbreakers. Quarantine is a public health strategy, and therefore it is very important to separate a public health strategy which is supposed to be embraced, supposed to be supported, supposed to be looked at it positively, with lawbreakers who walk at night and break the curfew law or rule. Therefore, this discussion is ongoing, and we have brought the concerns of the counties, and it is going to be dealt with very, very soon, such that a quarantine is, if you are in contact with a positive case, then you are quarantined for that reason. You are not a lawbreaker. You are not in any way broken any law, and there is nothing stigmatized or there's nothing negative about it. It's a public health strategy. But if you are walking at night, you are a lawbreaker and you should be dealt with. Maybe the place to go is the quarantine within prisons, not quarantine within public health facilities. That debate is ongoing. We have raised it, and we will be able to come to a clear conclusion about that, because it's a serious issue that has to be separated. But the issue of people not going to health facilities because of cost of quarantine, that I think is also a possibility, but more importantly is for the fear of the disease. Nobody wants to catch coronavirus, and coronavirus, is more likely to be infecting in areas where there is more visits, more touching, and more crowding, like in health facilities. And that's why we closed hotels, we closed all places, but we cannot close hospitals. So that stigma is still there of getting infection at a hospital. But we are trying to create a policy, a protocol, where there is social distancing even in clinics, and also there is fumigation of health facilities to minimize but the final or the long-term solution is to have COVID facilities away from the normal hospitals so that people can have the confidence to go and be attended for clinics, for malaria, for TB, for HIV, and other health conditions. Thank you very much.